So what we've got to focus on is implementation. And there are a couple of key dates. One is that the exchanges are likely to open October 1st. The second is, and this has been announced now, that the employers have to tell their employees what they're doing in terms of health care by October 1st. Those two things obviously have to happen together. You can't tell the employees about the exchanges unless the exchanges are open, so the first drives the second. The third date is pretty critical, but it's not anywhere in the legislation, and that's that if you are an employer who believes that they need to adjust their schedules in any way to influence who's going to qualify for insurance, etc., July 1 is sort of your final line in the sand, because you've got 90 days from July 1 to October 1st. And remember, in October 1st, when you go to notify your employees what you're going to do, you have to know with absolute certainty who you're going to offer insurance to, down to the individual. So if you haven't laid some back history and at least a 90-day look back for them on that, you're leaving it to chance. And as you'll see throughout these slides, one thing you don't want to do with any of this, if you're a prudent business person, is leave anything to chance. So even though there are hundreds or thousands of pages of rules and regs on this, I would argue that from an operator's perspective, it's not all that complicated in terms of the decisions that you have to make. So I take operators through a very simple decision tree, and it starts with one fundamental question: are you a large or are you a small employer? Large, as you probably all know, 50 or more full-time equivalents. Small, less than 50 full-time equivalents. And also, I always emphasize this to operators: the only time you'll ever hear the term full-time equivalent is for the determination of whether you're a large or small employer. People get very confused, operators get very confused by that term. Other than determining your status as a large or small employer, you never worry about the word full-time equivalent. So if you can clear that up with people, it helps prevent a lot of confusion as you're going on and then talking about full-time employees, which is something else completely. All right, so the large employer formula, it's measured monthly. If you're you would take every month individually, run this formula, average the 12 months, and then if it adds up to more than for the 50 or more, you're large. I don't think everybody here needs the details on it. And by the way, the book that was passed out is such an excellent resource. 24 pages of the best information you could ask for from the National Restaurant Association. I'm using that as my primary sort of technical Bible at our franchise conference. We'll be handing it out to all of our operators. All right, so what's a typical Firehouse restaurant look like? Coincidentally, a Firehouse subs restaurant is about the same average unit volume for company restaurants as a typical restaurant in America. We do $800,000 a year in sales, have $100,000 EBITDA, and at least on the sales side, maybe not the EBITDA side, but on the sales side, that's reflective of an average restaurant in the United States. So our restaurants average 17 employees. One of those is a salaried manager who I already provide insurance for. We have a great insurance program. We pay 100% of the premium for their individual coverage. Then we have 16 hourly employees. And we looked at our 2012 records, and of those 16, 3 were full-time under the government's definition, 30 hours or more, and 13 were part-time. And if we ran the whole formula on the entire average workforce, we have 10.5 full-time equivalents per restaurant. So within the Firehouse system, if you're running around the average, if you're an operator with 5 or more restaurants, you're almost certainly a large employer. You're over the 50 full-time equivalents. If you have 3 to 4 restaurants, we're advising them, hey, you definitely are going to want to run the formula, because depending on your sales volumes, number of employees, you could be right on the bubble. And if you're 1 or 2 restaurant operator, you're almost certainly a small operator. One thing that is great, I'll get your question in a second. One thing that's great is that the federal government has been very gracious to take your word for it if you want to say that you're large. So kind of them. But the good news is with that, you don't have to run the formulas and jump through the administrative hoops, which is actually a big relief, because you see these onerous calculations, and if you're a really large employer with hundreds or thousands of employees, you're thinking, oh my God, I got to go through this whole thing. But you don't. All right, so, and again, it's glaringly obvious usually when you're small. If you don't have more than 50 employees, no matter how many hours they work, you can't be a large employer. I know it's going to be extremely rare for you to have all 50 employees that are working 30 or more hours a week, at least in our business. So it's going to be a somewhat narrow range of operators who are going to be around the bubble where it's going to be really critical that they run the formula. The best thing to do with all parts of this law, and on that part in particular, is adhere to the spirit of it. So what the government's looking at is ask your accountant or legal advisor, but general rule of thumb is you have more than 80% common ownership. You're all in one bucket, and there's going to be no dodging it. If you do, you're probably running more risk than it's worth. And by the way, anybody who wants to chime in, because I know we have a lot of experts between the broker community, legal expert, jump in. Feel free. All right, so if you're a small employer, going back to your decision tree, or if you're small or you're large, pretty simple if you're a small employer with less than 50 full-time equivalents. If you're not going to offer insurance, if you make that decision, have a nice day. Life is pretty easy. You have some technical things you have to worry about with some aspects of your payroll reporting. But bottom line is you have very few worries. You can go about scheduling your employees however you want. You don't have to worry about how many hours they work. Life is easy. Now, if you are going to offer insurance as a small employer, because just because you're small doesn't mean you don't well, you may want to. And in fact, for competitive reasons, you may well want to. You can do it with much less fear of making mistakes. You can't be in the penalty box, if you will, if you're a small employer. All right, now if you're a large employer, now you're at a critical moment in your decision tree, and you only have one of three options. And this is where we try to simplify it for everybody. You can offer insurance, or you can choose to not offer insurance, and you're going to face penalties if you go that route. Or option 3 is you can offer insurance, but it doesn't qualify as being affordable or offering or providing the minimum benefit of 60%. And you'll face penalties if you do that. So those are your 3 buckets you can be in. So one thing, if you're not going to offer insurance, as you were talking about on the penalties, yeah, all right, well, you're not going to offer it. You're dealing with the penalty. The good news is you get an exemption for the first 30. So if you don't have more than 30 full-time employees, no worries. You can continue to schedule them. They'll be full-time, no problem. The penalty only kicks in above the 30. So you have 32 full-time employees, your penalty is $4,000. $2,000 per the 2 above. Remember, no FTEs. FTEs are out of we'll purge that from your mind. So these are only if you have an employee who averaged more than 30 hours during a look-back period. I don't want to get ahead of myself, but you get to select your look-back period for how you want to judge your employees. It applies to everybody. It could be a minimum of 3 months. It could be up to a year. Different strategies for picking different time frames. But any of your employees that you don't cover that are full-time, that averaged 30 or more hours a week during that look-back period, you'd pay a penalty for them. But again, you get a pass on the first 30. So again, if you're in that range, you're in good shape. Now, if you want or need to avoid the penalty, and I emphasize the need because just because, as probably all of you know, just because you're a large employer doesn't mean you're profitable. Right? And the government makes a pretty faulty assumption on all this, that just because you're large, you can do this. If bottom line is you don't have the cash flow to buy insurance, you don't have the cash flow to buy insurance. And you also may not have the cash flow to pay the penalty. So you've got one option if you can't afford to pay any penalties, and that's don't have more than 30 full-time employees. And of course, but as you know from the public relations end, that has a lot of baggage associated with it, with your consumer, certainly with your employees. But that's your out. So the decision is, pretty not an easy one to make, but a clear choice. Now, if you are offering insurance, here's my advice: treat it like an investment. Anything I spend money on in business, it's got to be for a good business reason, and if I'm looking for a return on it. And if I'm doing that, you have to understand your business objective. If I'm going to plow tens or hundreds of thousands of dollars into insurance, it's going to be with a clearly understood business objective on my end. And if you're going to do that, you have to establish a budget for it, just like any other line item on your profit and loss statement. So to your point, was it Mario? Was it? Yeah. Exactly along the lines of what you're saying. One of the unknowns is we don't know, we don't have quotes yet. So our working assumption, I'll love it if it comes out to that number, but our working assumption has been $5,000 per year for a bronze level package, okay, per employee. Now, as an employer, they give you a safe harbor. It's a lot more complicated than this because in the end, they'll penalize based on percentages of household income, but there's no way for you to know it or calculate around that. But, Joan? Oh, I'm sorry. I thought maybe you had a question. All right, but the government's giving you a safe harbor as a operator, where as long as you don't charge the employee more than 9.5% of their W-2 wages, you're out of the penalty box. All right, so think about what that means in our business for a typical minimum wage employee. If you charge them more than 9.5%, and if they go to the exchange, in essence, and that's revealed that you were selling them or proposing that they buy insurance that is not affordable because you charge more than 9.5% of their wages, then you're looking at a $3,000 penalty. Right. So when you establish the budget, what are the variables? Well, you've got to decide what's the portion of the premium that you're going to pay. You've got to determine how many full-time employees you have, and then here's the big unknown to determine the budget. What percentage of your full-time employees are going to accept the insurance? Because your only requirement under the law is to offer it. You are not required to buy it for everybody. All right, so that's the big unknown. How many will get it? Well, let's talk about the impact on the employee. All right, because here's the minimum safe harbor if I take the federal minimum wage, and this is, of course, higher for Florida, but using federal minimum wage of $7.25 times 30 hours, that 9.5% of that nets out to $20.66 per week, $1,074 per year. Everybody in America would be safe with that as their safe harbor, or the amount that they would charge an employee in their business. What does that mean to the employee? Well, for an employee who doesn't have insurance today, who hasn't wanted it, but feels compelled to get it, in essence is a 9.5% tax. I would tell you that the whole impact of the Affordable Care Act is much more onerous on the employee than it is on our businesses. That's something to keep in mind as you go forward on this. So their willingness to pay is limited. I've done focus groups with dozens of our employees in the Firehouse system. You ask, what do you think would be a fair amount to pay per week for insurance? And the most common answer is $5 a week. That's what they think would be a right amount to be charged. So what if they turn it down because they decide they can't afford it? Well, they face a penalty, just like we face a penalty if we don't offer it. Their penalty, $95 or 1% of their taxable income, whichever is greater. Now, if they have dependents, then there's a penalty for not having their dependents covered as well. But who knows it gets very complicated because who knows what the spouse's situation is, and the penalty for the kids is half of that. In the end, there's a maximum of basically 4 people at the $95 for year one. But no matter what, the penalties are a lot less than what they'd be paying for a premium that they don't want to get. And it goes up. In year 2, year 3, eventually ends up in year 3, I think it's at $695. And then it will be adjusted for inflation after that. But that is a long way off in the minds of the crew member. Oh, if they get insurance coverage, then they're qualifying coverage no matter where they get it from, then they're okay. So they don't suffer penalty just because they didn't get it from you. And that'll happen in a lot of cases. And by the way, another big piece of that is Medicaid. Because anybody who qualifies for Medicaid that's on your team, you don't have to offer them insurance. They're not going to qualify in the exchange for subsidies if they qualify for Medicaid. And this is, by the way, it's a bummer that in the state of Florida, this is my personal opinion, that we're not expanding Medicaid. And I know the government's in favor of it, and I know it took them a while to get there, but he should be applauded for it, is in the end, this is going to hit everybody. And if Medicaid had been expanded, at least it would have spread the cost out among the entire state, as opposed to saddling just business with it for those employees. So, and if you look at the number of our folks that are in that sort of income range of $11,000 to $14,000 and change, which is the group that all of a sudden would have been covered by Medicaid, that's a lot of our people in the business. So if you're into lobbying, keep trying to push that with your legislators. They really need to wake up and smell the coffee on that. keep in mind, everybody pays the penalty when they file their taxes. So for the typical employee in our business, they are getting refunds that are not just the hundreds of dollars, but sometimes thousands of dollars because of the tax credits and so on. So all this means is that when they go to file their taxes, and if they want to push it, we're not talking until April of 2015 before they file their taxes, and they'll get a refund that's $95 less than what they used to. When we talk about informing people, it's very important that we also inform our employees of this aspect of it and let them know just how little the penalty is as well. Because I noticed in the notification form from the government, it's glaringly absent in terms of what the penalty is. All right, so the big question is, how many of your full-time employees will accept the insurance? Let me jump back. The generally accepted number for the restaurant industry heading into this is no more than 20%. And that's based on the fact that there have been many, many companies that have offered health insurance to their hourly employees for decades. I was with one very major casual dining chain who had their precise numbers for their census. 8% of their hourly employees accept it. So 20% may even be on the high side. For my planning purposes, I'm assuming 33%. So I'm really going up a step just to be a little more cautious on the budgeting side. Yeah, I mean, depending on where the premium cost is. Going back to that $5,000 estimate, what I'm assuming for Firehouse, as an example, is that we'll end up paying 80%. That's going to leave $1,000 to them. If I really, since in Florida the minimum wage is higher than $7.25, I could push the safe harbor up a little bit. Maybe I could push it up to as high as $1,200, $1,250. I think it sends a terrible message to the employee to go up to them and say, hey, just because I can stick you for 9.5% of your wages, I'm going to. It's terrible. So what I'm going to do is just what companies have always done, which say, look, I'll cover a certain percentage. Now, that percentage I pick has to fall within the safe harbor. 50%, unless the premiums are incredibly low, won't. But so people are going to have to examine the safe harbor, determine your appetite for what you can pay. And I imagine most restaurant companies will probably be paying, my guess is 70% on average, 75%. Everything that you do for planning for it, everything about enacting this from an operator's perspective, in the end boils down to how you schedule your employees. We've got this established track record in the restaurant industry. Again, no more than 20% of people accepting it. Well, what's changed starting in 2014? Their economic situation is exactly the same. Their health situation, their need for health care is exactly the same. The only variable that's changing is the consideration of a $95 penalty. That's it. And if I'm staring in the face coming auto deducted out of my check $25 or $30 a week versus a $95 penalty when I file my taxes, and all other things having remained equal, the rate of acceptance is not going to change. It defies logic to think that it will. Now, maybe as we go into year 2, year 3, the penalty goes up. Maybe that will start to influence people's thinking a little different. But I would argue that even then, when it's up to $695, if I'm a 22-year-old and I'm still having to make that decision between, do I have $30 a week taken out of my check, or do I deal with the $695 in April of the following year, there's still a real good chance I'm going to turn it down. Because the $30 a week is the difference between paying my electric bill or putting gas in the car, or I got to skip going out Friday night with my buddies. That's the reality, and the people in Washington, D.C. don't have a clue about how the typical 22-year-old is thinking. Their exposure to a 22-year-old is a rich kid intern. With all due respect to everybody that works up there. But it's not, they're not interacting with the typical employee that's out in retail and in food service. All right, so we can turn this into something good. There's some minefields that you have to watch out for. First of all, as you're scheduling employees, you have to worry about people drifting above and below the 30 hours. It's a nightmare. People qualifying for insurance and then over the long term not qualifying. You haven't planned for any of that within your budget. So you really got to tighten up on the scheduling side. And if you don't, I predict two things, and Randy's done a great job of predicting what's going to happen in the absence of documenting the notification. Here's another pitfall that's going to happen. You're going to have a well-meaning manager who's been budgeted to have X number of full-time employees, and you're going to have thus offered so many insurance opportunities. Well, all of a sudden, they realize that they look back on their trailing period, and they've got a couple, 3 employees who are at risk of averaging over 30 hours on the look-back period. And what will they do with all the best of intention? They'll go in and slash the hours of those employees to go ahead and get their average below 30. Now, that is terribly unfair to those employees. That gives us a black eye as an industry. It's through no fault of their own. They're going to get slashed from averaging above 30 hours to a 10-hour work week. And it's incredible. If that happened to any of us, we'd quit, we'd leave, we'd be looking for other places to forge our careers. And that can lead to lawsuits, by the way, too, for being denied benefits. And they'll say, hey, wait a minute, all my hours are being cut because they're trying to deny me a benefit that's being made available to others. And you also may have partial unemployment claims, by the way, depending on the state. So as we've looked at all the minefields and the challenges that are here, we said, what can we do to turn this into a positive? And for us, that was all about scheduling reform. Because as an industry, we've not ever done a particularly good job of how we manage our workforce as far as scheduling. And some of it's just the nature of it. We do tend to do a good job these days, I think, of coaching people up. Hire them on. We've got more sophisticated on our orientations and that initial training. And we respond pretty well to the employee who comes up and says, boy, I'd really like to get more hours. Any good manager is going to say, well, you need to be cross-trained on more positions, be more valuable, work harder, smile more, whatever. Because we love to see the enthusiasm that they want to get more hours, and hopefully we can motivate them. But in most of our businesses, if we're rewarding one person for good performance with more hours, that is typically coming at the expense of somebody else. Unless you're blessed with big sales increases and you're doling out lots of extra hours in a given week. And we do a pretty bad job of how we coach the poor performer as we're adjusting their hours. In fact, in the worst case scenarios, we have managers who try to schedule employees out of a job. Still to this day, the 2 most anticipated days of the week for the employee are in that order: payday and the day the schedule gets posted. I've been in the business 39 years, and you can read them like a book coming in. They walk into the crew room, look at all you have to do is wait for their faces coming out. If they're smiling and upbeat, they like what they saw on the schedule. If they're hanging their head and they're bummed out, it's because they got about 10 hours less than they were hoping they were going to get, because it's rare for them to have any sort of fixed schedule. Now, the flexibility in scheduling is perceived as being a great thing in our industry for a lot of hourly employees when you talk to them. But what's much more important, especially these days in the continued slowly growing economic recovery, the hours that they can get, the money they can earn, is far more important to them than the flexibility, and it trumps healthcare by a mile. All right, so our answers for this within Firehouse and what I've been spelling out for the industry is we've got an opportunity to really clearly define jobs descriptions. That's what operators are going to need to do. You can't do business as usual where people are just getting hours at random, more or less, or so unpredictably week to week. And if we can build in more certainty, it's a win for both parties. Now, we give them names in Firehouse, but just consider this: engine crew is an A, rescue crew is B, ladder crew is C. Everything's got to be a Firehouse thing in our system. All right, so for your A-level employee, that is a full-time, 40-hour-a-week fixed schedule employee. I would say that every restaurant can do that to some degree. If you look at the demands of your business, the normal flow, you can carve out a certain number of fixed positions. Most don't do it. Okay, we're not used to doing it because we've never had to. But if you needed to, you could. And because in Firehouse, there will be no such thing as a 30-hour full-time employee or a 32-hour-a-week employee. If I'm going to offer the opportunity for insurance, if the employee is going to accept it, and if it's going to cost me $4,000 per year, they are going to be 100% productive. I am going to get every bit of enthusiasm and effort. And they're your best employees. You want them there as much as you can. So they'll work a fixed schedule. What we call the rescue crew or the B crew, they are specifically part-time in their job description. And it's not a contractual guarantee, but they'll know in their job description our goal is to ensure they average between 20 and 29 hours a week. And then the C crew, that's your entry-level folks, or some of maybe your younger staff or people who are deliberately working very short shifts, you know, that 2.5, 3 hour a day person that comes in that's critical for you to fill a lunch or part of a dinner shift. So we'll have clearly understood expectations for each of those. Again, for the A-level employee, so you can budget for this. You can decide up front, not leave it to chance, but you decide exactly how many full-time people you want. It's based on your budget that you've set aside for health insurance. Again, taking into account an expectation of how many people are going to accept it. And those positions are going to be coveted. And by the way, they better be awarded on merit and not by feeling sorry for somebody because you think that they've got a health care need. And so you want to somehow make health insurance more accessible to them. Okay. On the flip side, and this is even more important, you don't put people into those positions because you think they're not going to accept the health care or that they're covered by somewhere else, by a parent. It will be the undoing of morale in your organization if you've been canvassing people or even just guessing at that. People who are your full-time employees should be there on merit and because they can work that fixed schedule that you've said is critical for your business. The people between 20 and 29 hours, okay, they'll know that's where we're going to be. It's not a guarantee, but I am guaranteeing them this. If for any reason they're ever going to be scheduled for less than 20 hours, we're going to tell them why. Because we've got to fix that piece of scheduling people down for performance when they need coaching, et cetera, and then not talking to them about it. Because it's just a bad way to run your operation. And sometimes they'll need to be scheduled lower for pure business reasons. I have road construction happen, so I'm choosing between laying people off or spreading the hours out thinner. But you should be communicating about that type of thing. And then the new people coming in, entry level, as I said. And that also is an opportunity for us to have much clearer expectations when we hire someone. Because now we'll say, in order for you to ever get more than 19 hours a week, you've got to do X, Y, and Z. And it may be some very basic things. It may only take you a week to demonstrate them, but whatever you set for your organization. And boy, that gives somebody some motivation to say, all right, I'm going to do exactly what they're saying I need to do, or I'm never going to see a minute over 19 hours. All right, so the benefits you see on the screen, clear expectations with the employees. It really gives people an incentive to work up into those other positions and an incentive for us to do proactive coaching and so on. And then the steps are very basic for the operator. They have to determine their status. They make that fundamental decision on whether they're going to offer insurance or not. They then have to design the scheduling protocols that they need to support that decision and start talking to your employees. Start talking to them now. I've been talking to them already for 8 months, and we're way ahead of the game. They're becoming better educated about it, and they can't view you as the enemy. So, and here's one thing you need to ask yourself. How are your employees going to react? And what happens if you cut their hours intentionally? You go in and cut everybody below 30 hours. I have some great video from one of my focus groups. It reinforced everything I've talked about on this for a long time. So in addition to how your employees are going to react, you also have to ask, how are your customers going to react, and how is the media going to react? Because here's my advice to you. You've got to assume that everybody's going to know. If you don't, you're foolhardy. You've got to assume you're going to be the example. And your employees obviously are going to know. And if on October 1st, if that's the date for everybody to inform their employees, imagine all across the country that every employee in this country is being informed by their employer what is going to be done as far as health care. They're going to be back talking to their spouses at the dinner table that night. They're talking to the kids who just got informed and what they're going to do. And at the same time, between about October 1st and October 10th, the media will be running reams and reams of stories about what all employers are doing all across America, who's offering, who's not. You don't know if you're going to be in the mix on that or not. And, of course, your customers are going to know. And we've already seen enough evidence out there that they will penalize you if they think you're making a bad move. So, assume everybody will be aware. And this final thought: if you're not proud and transparent about your decision, whatever it is, okay, you may want to rethink it. and think about what you'd be saying about it on October 2nd.